Hi, this is Dr. Corey Maas on Looking Your Best. I wanted to take a few minutes to talk about a special condition which I see a fair amount of and certainly did a lot of at UCSF when I was a full professor there. The treatment of ear abnormalities or deformities. I did a lot of microtia repairs when I was a full-time professor at UC, and those are children that are born with just a little peanut for an ear. They have no external canal or auricle, the external portion of the ear. And obviously this is quite a dramatic deformity that requires rib grafting and is quite extensive and quite disturbing to the patients who have it. And we can help people that have that quite a bit with a procedure that's called microtia repair. But in general, what I see more commonly, and what many of us do see, and hopefully people with expertise, because it's a very nuanced procedure to get really good results, are patients that have outstanding ears, so-called Dumbo ears or Mickey Mouse ears. There's all kinds of names for them, and they actually can affect kids at very young ages, where they're the subject of ridicule and teasing by their friends, which can affect self-esteem pretty significantly. And so there are two populations where I see this. One is the population of kids that come in with their parents, and a lot of times kids won't be real open in talking about this. It's a source of embarrassment even with parents. So it's good to be open about it if they ever express some concern, and let them tell you about their feelings. And it's okay to empower them and say that that's okay to have ears that stand out, but that's not going to really change the fact that they're going to be the subject of some teasing from others, which, right or wrong, is the reality we live in. For those that would like to have that asymmetry or imbalance improved, or that should mention, the other group are adults who are now on their own and decided they're going to do it anyway, whether it's a self-esteem issue for them or they're just sort of rejecting the concept that they have to live with it, which they don't. They're going to do it in adulthood so that it more balances their face. And that's really what we're talking about, is balancing features and symmetry when we're talking about otoplasty. Outstanding ears where they stick out. Now, what's the definition? I've got fairly prominent ears, but what's the definition of an ear that really sticks out? Well, ideally we want to be in the 15 to 30 degree range if we're talking about the angle that the ear sticks out from the back of the head. It's considered an outstanding ear, or a ear that's over projected, if it's more than 45 degree angle. So a 45 degree angle is a rough estimate, but there are lots of sort of conditions that add to it, and we'll talk about the anatomy in just a few minutes. But the main thing to know is that if the ear sticks out from the conchal bowl at the bottom of the ear, or more commonly from the top of the ear, it's missing or has too much of two components. That's the cartilage here of the concha being too great, which makes the bottom of the ear stick out, or it's missing the actual fold here that's known as the antihelix, and that makes the ear flop over, which you'll see in the diagrams we're showing. So the important part of the surgery that we're doing is, which can be done under local, even with kids, they can do it with local. You don't have to have general anesthesia. We'll often give them a little oral medication to help them be settled and relaxed. But once the local's done, it's very easy to do in the office. We lift a small segment of the skin behind the ear. There's nothing that you can see in front. And we'll modify the cartilage with special sutures and some cutting through the cartilage to relax some of the memory, so that the ear sits back nicely and is in that 15 to 30 degree range. We really don't want it pressed up against the head. That's not ideal either. So that 15 to 30 degree range is the target, and by repairing the antihelix and the conchal overprominence with a procedure called otoplasty, we can get pretty dramatic results. And when I say dramatic, it's just balancing the facial features and making them symmetric and appropriate with the patient's face. This has a big impact, again, on children especially, but adults. I've got adults that have come in and for their entire lives have worn a funny or outdated hairstyle just because of their ears. And I think it's important that that we know that there's options available for repairing those. If you have any questions about the specifics of otoplasty, I actually will have some more videos that show the surgical indications and how we exactly do it, but I wanted to talk about these modifications, or at least the indications for it, and how we can address these in most of our patients. This is Dr. Corey Maas on Looking Your Best.